And we're back here at Encompass Health, where we're learning about all the wonderful things in the facility. And now we're talking to two of the nursing staff, Amy and Hailey. Nice to meet you ladies today.
Nice to meet you.
You both have been here since the facility opened for the most part. Tell us about your roles.
Well, I'm Hailey, and I'm a nursing supervisor here, and what I do is I'm kind of over the day-to-day operations of nursing, and I'm there as a resource for if the nurses need anything.
How many do you have on your staff, nursing staff?
About 20 right now.
And do they typically work the traditional 12-hour shifts?
They do. We usually work 6:30 to 6:30, so 3 12s a week.
Mm-hmm. And Amy, what about you?
I do nursing education, I do a little infection prevention, and some wound care.
Now, what makes the nursing and rehab maybe different from other programs?
What I think about rehab nursing is it's really special because the patients are with us a longer amount of time, and we can really develop a relationship with them and get to know them and their families. And that knowledge we gain about them can really be applicable to their care. We can tailor their care to them specifically, and that'll allow their healing to progress more rapidly.
Yeah, that sounds great. You get to spend time talking
Correct.
with them, and all that is helpful. And just like you said, the relationship, and so much of that is relational in nursing and
Correct.
healthcare.
Yes.
Now, you've got some special programs that you deal with, wound care you mentioned. Talk about some of those in detail.
Sure. So our wound care program, we have a nice team approach. We have nursing, we have a physician consultant, we have the dietitian. So we can look at the wound overall. We look at prevention. We have a lot of advanced treatments, wound vacs, things like that. So if people have those types of needs, definitely in rehab we can service them.
So after a patient will come here after they've been in a regular hospital setting when their care requires more than home, right?
Correct.
So tell us a little bit about how that works. When might you see a patient after they get out of the hospital, come straight here?
I mean, we get patients from home as well sometimes, but the vast majority of our patients are usually, orthopedic, so they've had a broken hip, a broken knee or something, or we get strokes, traumatic brain injuries. But we are really receptive to a lot of different diagnoses, and we're willing to work with the doctors and the patients to meet their needs.
Well, safety is obviously important in any medical industry.
Correct.
Let's talk about how you implement some of those here.
Sure. Well, that comes from a really good assessment both on the physician's behalf and the nursing staff. We gauge everything day to day, and I think what's paramount to it is rounding on your patients frequently. We have a, kind of a guideline here. Every hour on the hour, we look at the patient, make sure they're safe, and we kind of address those 3 Ps, pain, potty, and position. That way we can meet their needs. And like I said, we build relationships with our patients,
Right.
so a lot of times we can come to anticipate their needs, and that way we keep them
Sure.
safe in that way. We know what they're going to do, and we can kind of prevent them from making those wrong decisions that could harm them.
Now, you can spend a little more time with them maybe too, because they're here, like you said, 12 days in an
Right.
average case, and get to know them, and maybe spend a little more time in their room with them versus a regular hospital where they're kind of in and out a lot.
Correct.
How does that work in the day-to-day for you? How do you find that beneficial?
They have their goals of therapy, and they're doing 3 hours of therapy a day typically, and nursing has them for the other 21 hours.
Ah.
So we're going to still be working on, what are their goals, their transferring, their mobility. It gives us a lot more time to do patient education. So their disease process, how to be safe in the home, how to take their medications safely. So it just gives us more time to cover those things, to make sure the patient really is comfortable going home, that they're going to have a safe discharge.
How do you work with the rehab team? Well, we just spoke to them earlier in the show. How do you guys work together?
We have a really nice team approach. The whole team meets once a week, talks about that patient's goals of therapy. We have huddles daily where our entire team collaborates and really just talks about, is the patient meeting their goal? What can we do to make it happen? If they're having difficulty with a patient, they let nursing know, and vice versa, so that we are keeping our patients safe, healthy. But one of the nicest things in a rehab setting is the collaboration.
And we're looking around a little earlier. You've got a special room here for family to come. Talk about what can happen in there. What is it used for?
Well, we call that our day room, and it's available for families and their patients to come together, so that family traditions can stay alive even when you're in the hospital. But it's also a specialized room that if we have patients that have difficulty swallowing or need a little more guidance with eating, staff can be there with them and monitor them and assist them for safety as well.
So they don't have to stay in their room and eat. Like if family comes, they can get out of the room, they can enjoy another atmosphere, and that's so refreshing too.
It is.
For the family members as well, and it's a nice bright room and so forth. So you keep an eye on that. What else happens here in the nursing station?
Oh, there's a lot. We have a lot of physician collaboration. You know, those patients are constantly being assessed and monitored, making sure that everything stays within their parameters. We do some consultation, family meetings, you know, different things like that. So really, it's just the same as an acute care hospital. We have all the same medical conditions and needs. It's just that we're keeping these patients a little bit longer to get them on that road closer to home.
How about how the doctors rotate in and out? How does that work as far as the scheduling? They come and visit with their patients. How do you guys collaborate with them?
Well, we have a medical director, and he does round daily on our patients, and he's very involved with the nursing staff. And then we have a multitude of other physicians that are there and collaborate with the medical director to meet our patient needs.
So if someone is being seen by a particular doctor, and that doctor is obviously not here on site, they'll just come in and out and make their rounds, those visits. How does that all work?
Well, typically during the day there's always a doctor here, and they will see whatever patient is here to meet their needs, and then at night there's always someone on a call. And then we have physicians in the community that have privileges here that can come in and see for special needs like the wounds we've talked about, or nephrology for dialysis here on site and different things, so we can kind of keep patients' schedules here and they're not going in and out to different appointments.
Yeah, which is great,
Right,
for sure, and
very
great for the family members. They can just
As
come
well,
here, so
yes.
it's kind of a one-stop place for them. And as we wrap up, with just a few seconds left, any last words that you'd like to share with the viewers about the special thing about Encompass Health? What makes it so special?
You know, we love working here. We love our patients, and just getting them to meet their goals. I know that the patients who come here want to go home, and we want them to be successful with that goal. And that really feels good as a nurse. It's rewarding.
Yeah.
And I'm hoping it feels good for that patient as well, because usually they've been sick, they've been in the hospital a long time, and we're kind of that one stop right before them getting home and being safe, and that makes everyone feel good.
Thank you, ladies, for sharing all you do and your heart and your passion for wanting to help people. And we thank you all for watching this episode of 843 TV, where communities come to speak.